So I know this looks a little weird, but I positioned my computer this way to see if you guys could follow me over here with the NCLEX Saunders book. If you can hear me, please type yes in the comments so I can know. Please type yes in the comments if you can hear me. If you can see me okay, please type something. I got my notes right here. I don't know if you can see them. I have my notes. I have my sticky tabs. Okay, I have bigger sticky tabs. I don't know if you can see. I did write on them. Well, I wrote on this one, if you can see it. Okay. I did tab some of my book already, but this is a new book. And so you're going to watch me tab some of the stuff, the most common stuff, live today. So I'm going to wait for more people to come on. Hello, 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 everyone. Okay, so I'm pretty excited about this. I did this a couple years ago in 2016 maybe, and it was a big hit because a lot of people just feel very overwhelmed with the Saunders book. They don't know how to use it. They fall asleep. They feel like it's intimidating because it's so big with all this information. But of course, I am the queen of study tips, okay? And I give you the best study tips on how to work with Saunders. So first things first, I would like for you guys to please, please, please open the book. Don't be afraid, okay? Take baby steps. You don't have to read it cover to cover. That is not what having the Saunders book is all about. You have to treat the Saunders book like it's a recipe book. I always say that. When you have a recipe book, you don't go in and read all the recipes just to decide what you're going to, make for dinner that day. No, you don't read it like that. Or you could treat it like it's your Bible. I don't know what religion you're in, or Quran, or whatever. Okay, whoever you practice to, if you believe in the Bible or some type of form of it, you don't read the Bible cover to cover. You go in, you get what you need for whatever issue you're having, right? And then you put it aside. That's how you got to treat the Saunders book. Absolutely. You have to treat the Saunders book like it's a recipe book or like it's your Bible, okay? You go in, get the little bit of information that you need, and then you set it aside. You get the information that you need to understand. Let me say that again. Don't just go in and read and then don't understand. You get the information you need to understand, okay? So that's the first thing. Don't treat it like it's a normal, regular book. Treat it like, oh, you're going in to get something and then put it aside. The next thing is become familiar with the book. Become familiar with it. Everything you need to know as far as content is in the Saunders book, okay? If your school is using ATI, that's fine. If you're using a question bank like UWorld, that's fine too. But back it up with the Saunders book, because they worked really hard to put this book together. And guess what? This book, if you look at the resources in the index, it comes from your med-surg books. Whatever med-surg book you have, it could be Tabor's, it could be Lewis, it could be, I guess it's called Icovitigus. Some of the stuff comes from Perry and Potter. Your nursing school textbooks are all, they pull from your textbooks and they've combined it here, just shortened, okay? So don't be afraid of the Saunders book. If you're afraid of your nursing student school books, then, don't be afraid of the Saunders book. It's not going to jump up and bite you, or it's not going to, if you use it correctly And like I'm going to show you here today, if you use it correctly, then you can get somewhere with it. Okay, now I have these tabs here because this is how you get familiar with your book. All right. Of course, we all know Saunders is by systems. So fundamental system, right? Med-surg, adult health system, maternity, mental health. Inside the systems, you have different topics. Okay, so let's take fundamentals, for instance. Let's say you're weak in infection control. Okay, that's my first example. You're going to go inside the Saunders book and you're going to find the infection control chapter and you're going to tab it, right? You're going to tab it so you can get back to it at a later date. If you don't understand something, you know exactly how to get to it, right, quick, fast, in a hurry. You know, you don't have to spend time fumbling. That's the reason for the tabs, okay? I do have some tabs here already. I don't know if you can see them, but one is informed consents. The other one is fluid and electrolytes and acid base, because those are the most common weak areas that students and graduates have. So I tabbed my book to for when a student comes to me and says, hey, I'm weak in fluid and electrolytes. Boom, I could turn right to it. And I already got some color coding and the margins going on here, okay, to help my students quick, fast, in a hurry. That's how you want to help yourself as well. Same thing with acid base, okay, boom, you turn right to the page. It's quick, fast, in a hurry. All right. In the RN Comprehensive Saunders book, it's a little bit more detailed than the PN Comprehensive Saunders book, okay? LPNs, if you're in nursing school, you might want to get with someone that has an RN book, only because the RN book gives you details that are very important. I don't know if you can see this, but some of my students are like, man, the PN book does not explain why an acid base asthma may cause respiratory acidosis. Okay, it's very important to know your causes, right? Because that's how the NCLEX or your exams is going to quiz you. So, boom, it's right here. It's right here. These boxes are important. Don't skip over them, okay? Just take your time, figure out what's in the box. If it's something that you need to know, causes of respiratory acidosis are very important, okay? So PN graduates and students, get with somebody that has this RN book, or you can rent it free from the library, because it goes a little bit more depth with the patho and why things happen. So for example, it says asthma. Spasms result from allergens, irritants, emotions cause the smooth muscles of the bronchioles to constrict, okay? If you didn't know that respiratory acidosis, that asthma could cause respiratory acidosis, now you know. Now you know where to get it, right? And if you're looking for other causes, such as within the metabolic acidosis or metabolic alkalosis, it's here. It's in the boxes, okay? They put them in boxes for you for a reason, for the RN Comprehensive Saunders book. So those are some of the important things. If I'm telling you, as your tutor, for a study habit, for acid-base imbalance, right? If I'm telling you, there are 2 ways to study acid-base imbalance. There are 2 ways to study. The first way is to know your numbers, correct? Some people like to use tic-tac-toe. That's one way to know your numbers. The second way to know your numbers is by using Rome and the direction of the arrows, okay? Some people use Marquet, and he says overventilating and underventilating. It's all in here. It's all the same, okay? That's one. Those are That's the first way you study acid-base imbalance. The second way you study acid-base imbalances is by knowing the causes, period. Those are the two ways. If I give you those two ways, go to your Saunders book and find that information. That's the information you want to pull out. That's the information that you focus on. Everything, you don't have to read everything. You pull out that information, okay? For example, respiratory alkalosis. Okay, respiratory alkalosis. It's here. You got the causes in the box, right? Causes in the box. And then some of the patho is going to tell you whether it's overstimulating or understimulating, or overventilating or underventilating. Those are the key words that you should be pulling out of the Saunders book. And then get your interventions. What do you do when a person is in this imbalance, right? Interventions are very important. That formula that I gave you yesterday for knowing the normal, then you can recognize the abnormal, and then going to get your interventions. That is how your study sessions should be driven. That is how you want to study inside your Saunders book. Normal, abnormal, interventions. What am I going to do as the nurse if a person has this? Stop thinking like, okay, I strictly have to study acid-base imbalance, all this information. No, make it relatable to you. If you're the nurse and somebody has metabolic acidosis, don't you want to know why? Don't you want to know what it should be normally? Don't you want to know what you should do about it if somebody is presenting symptoms to you? That's how you have to think like a nurse. That's how you have to use this book. I want to know. I'm nosy as hell. I want to know, what am I supposed to do if this patient is presented to me like this? What am I supposed to do? Okay? And I know where to get it. My interventions are in the Saunders book. And that's what you put in your notes. That's how you organize your notes. So, again, let's go to another example. Infection control. Let me find it in here. There are two ways to study infection control. Well, really three. Really three ways to study infection control. Infection control is inside the fundamentals chapter, okay? And if you're studying for NCLEX, it is your safe, I think it's safe and effective environmental care category, okay? I just gave you a gold nugget right there. So let's find infection control in here and see how we can tab our Saunders book. See, if I had already tabbed, I would already be to that area, but I don't, so I saved it strictly for you guys today. Okay, so I think it's here. So it's here under the 16th chapter, and it's provision of safe environment. Okay, let's say I'm weak in infection control. Okay, I am giving you techniques to study infection control. So, two things you want to pull out. Precautions, right? There are two types of precautions that you want to study. Standard precautions, you want to know what goes into standard precautions, and transmission-based precautions. So you're going to tab your Saunders book, right? Infection control. I'm going to go ahead and tab this. I actually want to use a smaller one. So I'm going to use another neon orange one and tab infection control. Isn't this exciting? So I'm going in my chapter 16, right? Provision of safe environment. And now I'm tabbing where my infection control starts. So it starts on page 195, and this is where I'm going to tab it at. I'm going to tab it below here so I can get it. Okay? And now I'm going to pull out what I need to know for standard precaution. What is standard precautions? Gloves, right? For body fluids, eye protection, mask, gowns. Those are all your standard precautions, okay? If anybody has anything that's contagious, that is when you get extra precautions, your extra transmission-based precautions, okay? So that's where all the airborne interventions come in, and that's where all the, what else? Contact precautions and the droplet precautions and which diseases are contagious and what you're going to do about it, okay? Again, standard precautions is normal, it's universal. The abnormal would be the transmission-based precautions, right? So again, that formula is popping up that I gave you: normal, abnormal, interventions, evaluation, right? Normal is standard precautions, okay? Abnormal would be your transmission-based precautions. And your interventions, you need to know which disease is contagious and what you're going to do about it, right? Airborne precautions, tuberculosis. I'm going to put you in a negative air pressure room. Boom, boom, boom. That's it. That is what should be in your notes, right? And then when you come across a question, when you're doing your NCLEX style questions, whatever's in that rationale that you didn't know, you're adding it to your notes. But you shouldn't have to go back to Saunders once you set it up in your notes. You shouldn't have to go back to Saunders, okay, and work extra hard for that information. You should be pulling things out, putting them in your notes, and then adding to your notes from the questions. That is how you want to study, okay? So now, the second thing that you want to pull out from this provisions of safe environment is your bioterrorism. Bioterrorism, okay? Sometimes they do have questions on bioterrorism. So let's see. I'm actually going to highlight bioterrorism because I see it often. So it says biological warfare agents. Biological warfare agents. There is two things you need to know about biological warfare agents. The first thing is it contagious? You go in, and the first thing is anthrax. Is anthrax contagious? That's what you want to know. Is it contagious? Okay? It is not contagious. It has a whole box on how it's spread and if it's contagious or not. So, it's not contagious. That's the first thing you need to know, and that's the first thing you should be putting in your notes. Is it contagious? No, it's not. Well then, how is it spread? Right? Somebody type in the comments how anthrax is spread. It's 3 ways anthrax is spread. That's the information that you need to know. I was just trying to see if there are any interventions. And it does have a treatment of antibiotics. So that's what I'm going to highlight, the treatment, okay? It says anthrax is usually treated with antibiotics, which is one of our interventions, right? One of our interventions is administer medication. So which medication am I going to administer? That's what you're pulling out of your Saunders book. So for anthrax, which is not contagious, it's spread by what? I don't see it in the comments. How is it spread? Contact, inhalation, and the third one is subcutaneous. Thank you, Regina. Very good. So, 3 ways. It says the skin, gastrointestinal, and inhalation, okay? That box is important. That's what you should be pulling out, okay? So, and then your intervention. What are we going to do? We're going to treat it with ciprofloxacin. It's telling you. Doxycycline, or penicillin, right? Boom. That should be in your notes. What did I say about bioterrorism? 2 ways to study. Two things to pull out that's very important. Is it contagious? How is it spread? And then, of course, what am I going to do about it? Okay, same thing. Let's do one more. Botulism. Okay, is it contagious? Is botulism contagious? Yes or no? Do you know? Botulism, you pretty much want to know and read what it is just to get an idea. Botulism is a paralytic caused by a nerve toxin. Okay, fine. Is it contagious though? No, it is not. It's not contagious. It's not contagious. That's what you should be pulling out. Is it contagious? No, is it? No, it's not. How is it spread? By the soil and by improperly canned foods. Okay, improperly. What did it say? Improperly. Sorry, my man is drawing a blank. Canned foods, improperly canned foods, or if you have a wound that's already infected. Okay, already infected wound. All right. So a couple years ago, there was an Ebola outbreak in the United States, right? Ebola was in the Saunders book already. It was nothing new. It was nothing new. But it just became a more current health issue, right? So in the Saunders book previously, before, they had it as hemorrhagic fever, okay? Now Ebola is in here. It says Ebola virus disease. Is it contagious? Yes, it's contagious. And then since it's contagious, then you go and see what transmission-based precautions you would need for that in your interventions. Okay? So this edition is 7th edition RN book. Okay, the 7th edition RN Saunders book. So let's tab something else. So let's say I'm all good with fundamentals and I want to move on to med-surg. Okay, fine. Let's do cardiac. I think cardiac is not tabbed in my book. We all know we have problems with the cardiac chapter, okay? So I'm going to go in here and I'm going to tab. So the Saunders book has a medication chapter after every adult health chapter. So I'm going to go ahead and tab my cardiovascular system, okay, just so I know where it is.
How much longer?
Just a few more minutes.
It's re-stressed.
You should be here in the room. Okay, so now, okay, I tabbed my cardiovascular system, but now I'm going to tab the cardiac medication chapter because pharmacology should not be studied separately from whatever disease process you're studying. Just to let y'all know. Y'all make it way too harder on yourselves. I'm breaking down pharm right now, Becca. Hey, you read my mind. Great minds think alike. Okay, so after every adult health chapter, there is a pharmacology chapter on that disease. So cardiac, if that's the system, then I'm going to go ahead and tab where the start of the cardiac medication chapters is. Okay? So they have questions at the end of every chapter. Okay, fine. But now I'm going to tab my cardiovascular medication chapter. All right? Why am I tabbing this? Because I want to know for my interventions, if I'm administering medication for a cardiac patient, I want to know all about that medication. Let me give you an example. So, if I'm studying about heart failure, okay, let's say I'm weak in heart failure, or let's do myocardial infarction. Let's say I'm weak in myocardial infarction, heart attack, right? And of course, the Saunders does have diagnostic tests in labs, in anatomy and physiology, which is fine. Do I want you to go read all that stuff? No. No, don't just read it to be reading it. Once you go into the disease process and you want to elaborate more on, okay, this person has a heart attack. What test is going to define this, right? It tells you. So let me get to it, sorry. So myocardial infarction, here it is. It's already highlighted, right? If I want to know, okay, this person is presenting with symptoms of a heart attack, right? Boom, here are your symptoms. But I'm not going to go to my symptoms first. I'm going to go to my interventions, okay? I'm going to go to my acute intervention. And I'm going to see what am I supposed to be doing for this patient because I'm nosy and I'm curious and I want to know, right? So one of my interventions is going to be administer angiotensin. Okay, what the hell is that, right? So I'm going to flip to my cardiac medication chapter because I'm weak in myocardial infarction, and one of my interventions told me to administer an angiotensin, and I'm going to find that classification. Find the classification. Let's see, where is it? Here it is. It's in a whole box. It has a list of drugs. Do I want you to memorize the list of drugs? No. Pick 2 or 3 drugs that you're familiar with, that you know is an angiotensin in that classification. So we got PRIL, your favorite endings, right? Don't stop memorizing drugs by their endings. It's going to get you caught up every time. Know the classification and what's inside that classification. So here it is. I'm weak in myocardial infarction, and they're telling me as the nurse to administer an angiotensin converting enzyme. Okay, fine. What is it? Because I don't know, right? What is it? Because I don't know. This is what you should be quickly reading about. Just reading about what it is, what drugs are involved. It's here, sorry. What drugs are involved? It's the sartans, which is, no, this is, yes, angiotensin 2 and angiotensin 1. So angiotensin converting enzymes are your ACE inhibitors. It's not anything you haven't heard before. And the angiotensin 2 receptor blockers are your sartan drugs, your cholesterol drugs, right? Right? Okay, so it's here. All you have to do is read about it very quickly and identify why you're giving this medication. Why am I giving a sartan, a receptor blocker, an angiotensin receptor blocker? Well, if you go back to the patho for myocardial infarction, it can be due to plaque buildup, right? Plaque buildup to the coronary artery that cuts off that circulation to the heart muscle, right? And then the heart muscle starts to die. That's the actual heart attack, right? So why am I giving them this sartan, this cholesterol medication? It's to keep the plaque from building up. Boom. That's all you got to put in your notes, right? Keep it simple. I'm not asking you to write all this. I'm asking you to find out why. Why am I giving this medication? What is in this classification, okay? And what 2 or 3 drugs can I pull out from this box that I'm familiar with? On NCLEX, for the graduates, you're going to get medications that you have never heard of, but it's okay. Why is it okay? Because you're going to know what's in that classification, right? You never heard of it, but they're going to give you similar things inside the classification that's going to make you critically think and say, oh, this sounds like a cholesterol drug medication, or this sounds like a bronchodilator medication, right? For the asthma patient. So that is how you study your pharmacology with your disease processes. Make them relatable, okay? Ask yourself those questions, those important questions. If I'm administering like infection, like going back to infection control, if I'm administering an antibiotic, why? Why am I administering that type of antibiotic for this patient? Okay, that's gonna go take you through your patho. Okay, how is this person with this myocardial infarction, with this heart attack, going to present to me? It's in your cardiac chapter that you tabbed, right? Cardiac chapter. Go to it fast. You know, you don't have to be fumbling around, and then you can just read about why, what signs and symptoms you're going to have for myocardial infarction. Everybody knows the crushing substernal chest pain, the numbness in the left arm, the jawline pain. Okay, those are the specific things that are specific in your to myocardial infarction. Those are things that are specific to myocardial infarction. Those are things that you should be pulling out. Those are hallmark signs specific for myocardial infarction. Are you going to be writing down nausea, vomiting, diarrhea, constipation? Because any disease process can have that. But myocardial infarction, what separates that from, let's say, heart failure, right? What's the edema? You may not necessarily have edema with myocardial infarction, but if you have left side heart failure, what are you going to have? Pulmonary edema, crackles in the lungs. That's different, right? That's a different sign or symptom for a different disease process. So you should be pulling out hallmark signs and symptoms for your disease processes. And you should be pulling out your interventions and what you're going to do as a nurse. Because if they say administer a thrombolytic, okay, you need to know the difference between a thrombolytic and an anticoagulant, right? They are two totally separate drugs, medications that will help the myocardial infarction patient. Does that make sense? If I'm making sense, give me some hearts, give me some emojis, like, are y'all still with me? I have 35 people on with me watching, and I hope this is making sense to you. Well, I know it's making sense to some people because you're answering, but it's important to tab your book, right? And to go in and get what you need and then just put it in your notes. That way, when you go to doing your questions, you don't have to lug the Saunders book around. You could just get all your notes, and then whatever questions, whatever rationales you have from your questions, right? You just add from your rationale to your notes that you already made from your Saunders book. Okay? So boom, boom, boom. Saunders, notes, questions, okay? Rationales. What in that rationale did you get wrong that you didn't know? Add it back to your notes and confirm it in Saunders. Okay, yes. My patient had an ICD cardiac defibrillator, okay? I don't know what that is. I tabbed my cardiac chapter. I'm going to read about it now, right? If you want to read about it, it's a whole section on it. A whole section on it, right? A whole section. Confirm that. I remember I had a UWorld question. A UWorld question about ICD defibrillators. I didn't know what an ICD defibrillator was. I got the question wrong in UWorld. So I added it to my notes. First, I wanted to see if it was going to be in the Saunders book. Went to the Saunders book. It's a whole section on it. Read up on it. Do you know when I went to my NCLEX, it was a question about ICDs during my exam? What if I hadn't never did UWorld? What if I hadn't never made those notes about ICD? I would have been stuck. I still would have been stuck on not knowing what and getting questions wrong on my NCLEX, right? But because I had the formula or the technique of, tabbing my Saunders book, getting the information I needed, and then once I answered my questions from whatever question bank you're using, I would add from my rationales. And was I writing rationales out? No. No, I was not. Whatever I got wrong from that rationale, I added it to my notes, went back and confirmed it in Saunders, and then I had complete notes where my gaps were filled in. Does that make sense? Stop making studying so hard for yourself. Stop making studying so hard for yourself. 2 to 3 hours a day is it. Go in, get what you need, do your questions, and then remediate your questions and add to your notes. That way, 2 weeks before your NCLEX, all you have to do is read your notes. Refresh, cram your notes, whatever, and then you'll be able to pass NCLEX, okay? Do I have any questions? Any questions? No, I am not tabbing tabbing my Saunders book when I have things that are wrong. When I get a question wrong, I tab based on my weak areas. So if I find out that I have a weakness in cardiac, that's what I'm going to, tab and study and create notes on. If I know I have a weak area in acid-base balance, that's what I'm going to tab. That's what I'm going to create my notes on, okay? So I advise you create notes by systems so they're not all scattered. Most of you like to answer NCLEX style questions based on all of the categories in that question bank. Don't do that if you're creating notes and you're studying, because now your notes are going to be on growth development here, myocardial infarction here, mental health over here. It's too scattered. You're not going to retain anything. So I advise that you just write on a piece of paper. It's not that hard. What are you weak in? Ask yourself, what am I weak in? Okay, I'm weak in pharmacology and I'm weak in adult health. Fine. Write it down and then tackle the individual topics that you're weak in, right? Do that content refresher first. That way, you'll know when you read your rationales, oh, I knew that part of the rationale, but now I didn't know this part. I'm going to add this part to my notes. Does that make sense? I hope that's making sense to you guys. Do I have a format for my notes? I do have a format, and it's called My New Study Plan. So let me see if I can get that link for you. It's called My New Study Plan. Let's see. I have it here somewhere. Okay. So if you're weak in everything, stop it. No, you're not. You know more things than you think you know. I always do that. I always say that to people. They're like, I'm weak in everything. No, you're not. You know some stuff. I be trying to put people on a spot so they could teach me what they know. But the most things that you struggle with in school, or the things that you struggle with the most, like maternity, I know is a big one. Cardiac is a big one. Fundamentals, fluid and electrolytes is a very big one, okay? You need techniques. You need techniques that are going to help you pull out information that's need to know, right? That's what I'm giving you. When I do my lives and I come on and I say, or I post my study tips inside of the group, I'm expecting you guys to take what I give you and implement that. Take action on it, okay? I just told you 4 ways to study using different techniques, okay? Make sure you rewind this video and watch it again if you have to. Remember, infection control, what did I say? You need to know standard precautions, transmission-based precautions, right? And then for bioterrorism, you need to know if it's contagious, and you need to know how it's spread and what you're going to do about it. Period. You always want to go in and get your interventions no matter what. Okay, so that's a given. You always want to go into the Saunders book and get your interventions. All right. Chest tubes is in the fundamentals chapter. Okay, go back into your fundamentals chapter. Tab the chest tube. Let's do that right now. I'm gonna tab chest tubes. Test tubes. Chest tubes. Because that's another big one. Chest tubes. See? I don't know if you can see it. I'm such a lame. I'm gonna tab chest tubes right now. Let's see if I can find it. Because I know that's a very big one. I think it's going to be in the I don't know if it's okay. Oh, it's going to be with the tubes. Clients with tubes. That's what it is. So, boom, turn right to it. Now I'm going to tab my book. I think it's this way. So now it tells you chest tube drainage system. Okay? Chest tube drainage system, and here it is. It's in your Saunders book. I don't know if you can see it. And it gives you everything you need to know. So you're going to make notes on this, right? And you're going to go over those notes 2 to 3 times a week. I don't know if you can see it. Let me see. There is your suction control, gentle bubbling, dry suction, water seal chamber. It's all there. Don't be afraid to go in the Saunders book and study it. Put it in your notes. When you get a question on it, add to your notes about what you didn't know. All right? Let's see. So, okay, I'm not going to keep you guys. I've been on for 45 minutes. If you are just, bummed about studying the Saunders book, don't be. I promise you, you will not regret it, okay? You will not regret pulling the information out that you need to know, your weak areas, tabbing it, create your powerful notes, and then using your notes to study for your exams, your exit exams, ATI, HESI, whatever. Back up your information with the Saunders book. And if it's not in there, and I have found that the Saunders book has minimal contradictory information. Minimal. Like I've also used the, Pearson Comprehensive Marianne Hogan book that has some contradictory stuff. The Kaplan content book that has some contradictory stuff. And guys, when you approach lab values, guess what? They're not going to all be the same, okay? Get one